Sugar, a magical combination of letters that can change our dull environment to a happy moment. It can give pleasure and put a smile on crying kids, besides as a source of energy in our diet. Unfortunately, we see more and more negative consequences of excessive sugar intake. The list is endless. It is because sugar plays a role as a risk factor for many non-communicable diseases. Just name it. Tooth decay, heart disease, diabetes mellitus, stroke and cancer have all been linked to overeating sugar. Despite knowing this, most of us still struggle to resist that caramel mocha latte calling to us from the hipster cafe downstairs. Why? Even though there are many health education and promotion that have been done either at the individual or community level that incorporate various techniques and approaches. But why Malaysia is now the fattest nation in Asia? The prevalence of dental caries remain high since the first nation survey in 1970s, not to forget about diabetes mellitus as one of the major public health concerns in Malaysia. On average, Malaysians consume around 3 kilograms of sugar per year in the form of sugary drinks and average 10 teaspoons of sugar daily. Did all the health education and promotion are not effective? Previous research found that health education alone is not sufficient to create a sustainable decrease in sugar intake. There is no evidence that by giving and improving patients knowledge alone will influence their behavior. If it has so, it is only for a short time. And here is my research will contribute to find how to change the sustainable behavior in reducing sugar intake. The intervention based on psychological theory had a better outcome as it considers environment and social factors such as capability, opportunity, and motivation of the individual. This is my research aim, to develop a reducing sugar intake health education module based on behavior change wheel theory as a psychological theory on how we can reduce sugar intake. To do this, I try to figure out the barrier and facilitators in reducing sugar intake among Malaysians by conducting semi-structured interview. The next phase of my research is to explore any health module by doing a systematic review. The interview, the finding from this step will be brought to a group of expert panel to get a consensus and design of the module will be begin. And in the final stage of my research, the module will be randomly tested among patients. Now, imagine if you are among who received this module. We expect that you are at the lowest chances to get non-communicable diseases. You don't need any related treatment so that you can save a lot of time and money. And perhaps you have a healthy lifestyle and optimum quality of life. Remember, we can't run from the sugar, but we can choose to change the behavior to reduce sugar intake towards a healthy lifestyle.